Welcome to the Feels Club. My name is Mauricio Laguan, your host. Today's topic is GLP-1 medications and mental health, food noise, Ozempic. You've heard a lot of buzzwords around it. We're here to talk about it today. My guest today is Andrea Swensen, a physician assistant and provider at Anew Therapy, who comes with over 15 years of experience in the healthcare industry. You've been doing a lot of work around mental health, helping people on a physical transformation journey with GLP-1. Andrea, welcome to the Feels Club. We're very excited to have you here.
Thank you so much. I'm glad to be here.
You are one of our providers at Anew, and you primarily, correct me if I'm wrong, have been seeing patients to help them with GLP-1 medications, seeing if they qualify. Can you, at a high level, explain what is a GLP-1 medication without all that jargon that goes around about what it is and all these buzzwords?
Yes, I would love to break it down. Yeah, GLP-1s, you've heard all across the news, social media, so it's kind of a buzzword right now. But basically, if you break it down, GLP-1s are a protein made of some amino acids that help with energy, appetite suppression, that type of thing. A lot of patients are using them nowadays to help, to lose weight, to help with diseases just like PCOS you kind of heard about, and just overall losing weight and just feeling better in your skin.
It's also diabetes, heart disease, because it's helping with some of these comorbidities that come with obesity. Is that right?
Yeah, that's right. So it is helping with metabolic disease. So these medications have been on the market for about 20 years in the diabetes space. But most recently, the last couple of years, they've been used more they've now an indication for weight loss. So not only diabetes, but now weight loss is a new indication.
That's really cool. You mentioned appetite suppression, food noise. What is a GLP-1 actually doing to appetite, to your metabolism, to your gut? Like, what is it targeting? Is it all of those things? Is it...
Yeah, so it's pretty interesting. You have GLP receptors in your small intestine, actually all throughout your body. A lot of them are in your small intestine, in your brain. So, say we, for instance, if we go ahead and eat some food, right after we eat food, that GLP-1 is released in our stomach. And then that signal is kind of like a chemical messenger. It travels up to your brain via the vagus nerve, up to the brainstem, to the hypothalamus, where it was that center in your brain that controls the satiety and tells you to quit eating. So normally when our body's producing that GLP-1, the natural GLP-1, that only stays in your system for about 2 minutes and then it disappears. So what the drug companies have done is create the GLP-1, namely semaglutide or tirzepatide, which stays in your system for about a week. So having that suppression, the appetite suppression really helps people. And it does, work in that brain where it does quiet that food noise. So you don't have those cravings maybe like you used to. You're able to eat smaller portions, and it just really helps you overall metabolically also. Increases your insulin sensitivity. That's why it's very helpful in PCOS. And then just helps regulate your blood glucose levels. Instead of your blood glucose levels, going up and down and having those crashes metabolically, it just kind of evens things out and, helps you, quiet things down in your brain.
Yeah. It's doing a lot for a very simple medication. And what I'm understanding from what you're saying, the GLP receptors, the GLP-1 medications, helping both the physical component, right? Like what your gut and your metabolism is doing, but also like how your brain is processing food, food noise, feeling full. What are some of the common misconceptions? Because it has become such a popular word. It's become, Ozempic was like a joke for quite some time. I think people still use the Ozempic jingle every now and then. I remember those commercials. So like what are some of those like common misconceptions that people have when they hear about a GLP-1?
Yeah, so I think a lot of people think, this is like an easy way out, that type of thing. But honestly, I think this medication is very important for people that have underlying metabolic disease, such as PCOS. And I am speaking from my own experience. I recently was diagnosed with PCOS maybe 5 years ago. But before that, I felt like it had gone undiagnosed for years for me. And I had really struggled with my weight, even thinking back to high school, to college. I remember in college, I exercised like twice a day for like a couple hours a day. I would go to the gym after work and I'd run on the treadmill for like an hour, like 7 miles per hour, lifting weights, running outside, like really doing intense physical activity, restricting my calories and feeling so helpless, like things were not really budging on the scale. And then, once I started having children, gaining a lot of weight in between, with pregnancies and not losing that and not realizing that I had insulin resistance until I went to a functional medicine doctor and she's like, oh yeah, you do have PCOS. And that like, it clicked for me. And I was like, oh wow, I do have an underlying metabolic disease. And this is why I'm having such a hard time losing weight. So that's kind of my personal experience. But I think a lot of patients think also a common misconception is, all I have to do is take this medication and I don't have to do anything else.
Yeah.
That's something really common that I see.
And it's common even when you hear what people share online, right? It's like, oh, just take it. Or, and it's also become easier to access the medication. So I think it's kind of fed into this like fad almost, right? But to your point, helping underlying conditions and still having to put in some of that work. And I want to unpack some of those things with you. What qualifies someone to get on a GLP-1 medication? Is it, obviously some of these conditions that you talked about, but why would someone want to come into a GLP?
Yeah. So I first want to say GLP medications are not for everyone. So we have to do really careful screening as far as, it's not going to be appropriate for someone that's breastfeeding, pregnant, a type 1 diabetic, someone that has, underlying eating disorder, things like that, a history of heavy alcohol use, pancreatitis, things like that. It's not going to be appropriate in those conditions, but it is appropriate for someone with PCOS, elevated insulin levels, where 88% of the American population are have insulin resistance. I actually just read a study and saying that America is very metabolically unfit. So for a lot of patients, it might be a good option. Obviously, diabetics. I have used it in some of my patients that have rheumatoid arthritis, systemic inflammation. I have found it to be so helpful with those patients. So there is a population that it is really applicable. Obviously, I do take into consideration a patient's BMI. So if your BMI is 30 or above, you would qualify for the medication. If your BMI is between 25 and 30, you would qualify for the medication with a comorbid condition such as, hypertension, high cholesterol, elevated fasting insulin levels, elevated A1C, those type of things like your lab numbers. Yeah. But it's so case by case, and it is concerning with the availability of the medication, where it's, some patients will go online and do a 30-minute survey and then they're able to order the medication and it's so widely accessible, which it's scary because I think there's a lot of people on this medication that honestly shouldn't be. Yeah. Yeah. There is obviously when it is meant for you and you should have access to it. And I'm glad that things are more accessible, but it is scary, right? Because it is just like, you could just grab onto it and just try it out. I like what you're describing and in your experience and how you prescribe the medication and consult with your patients, that you're looking at the whole picture. You're looking at the health, underlying conditions. You're looking at what they're experiencing. We're obviously here at the Feels Club at the intersection of mental health and talking about helping someone's journey with their emotional experience. Our bodies and body image and our weight can have a lot of effect on that. So when you think about the intersection of GLP-1 medication, weight loss, body transformation, and mental health, like where do you see the overlap in your patients and how you approach your practice? No, I love this. I have seen the overlap between mental health and then using these medications. I have seen the fact where, patients will come in with severe depression, anxiety, start to get those things, working through things with therapy and medication. And then they come to this place where they're like, I think I'm ready. Some of this depression and the feelings that I'm having is due to how I feel about myself, how I look. I feel like, I'm not able to get out of bed in the morning. I don't want to go to the gym because I'm embarrassed how I look, whatnot. And so starting on a GLP-1 medication, I feel like it's just a synergistic thing. And if, with their mental health treatment, and it really has, helped a lot of patients. And it's fun to see that overlap and work with patients on the day-to-day. Yeah. Fascinating to see how it all, and I
can speak from personal experience too. I went on a GLP-1 medication a little over a year ago, and I was hesitant. I was like, I don't know, do I qualify? And that's why I asked you the question about qualification, because for a while there, I was like, everyone's kind of doing it. Like, should I? Can I? Will I? And, through friends in the industry and people that had experienced with it, I decided to just like knock on the door, right? Just like you said, like, let me talk to a trusted provider and say, is this something that could? And along with this physical transformation journey that you go on, the mental health almost kind of follows with it, right? Because and I know some people have experienced the opposite. They go through a mental health journey transformation and they're like, my body hasn't caught up to like where I am mentally. And so I really like exploring that space of, because I've experienced it, of going through a physical transformation and then saying like, okay, like I love working out. I love exercising. I'm eating better. The food noise is quieted down. And then you have like almost like mental space to think about other things, anxiety, depression. Yeah. Do you see that? Is it common with your patients that with the quieting of the food noise?
Yeah, it is weird because it does quiet that all down and you're not constantly ruminating, thinking about food all day. You do have space in your mind to think about other things and focus on other things. It is very freeing in that sense. And it does give you space to process those things that maybe you just couldn't before.
Yeah.
And you're not constantly thinking about food. I think it is important to also mention that you do have to be intentional while on these medications.
Absolutely.
With your nutrition, hydration, your movement. But it does definitely give you space to do new things that you hadn't done before. I have patients that now, are buying new clothes for the first time in 10 years, like they just didn't want to before. Going to the gym, doing Pilates, running marathons, doing all these things that maybe they hadn't done before. And they kind of have a new lease on life and they're just feeling a lot more confident in their skin.
Yeah. I think that's what's been so beautiful about seeing people. But there's obviously, there's beauty in it, right? That people are feeling better in their own skin, quite literally, because of the help that a GLP-1 medication can have. We've talked about food noise and the appetite suppression, but you've also mentioned insulin resistance. Can you explain what is insulin and like how it helps with insulin resistance conditions like PCOS?
Yes. So insulin is a hormone. Basically, it's released in your body when you eat food. And in addition to that, glucose is released into the bloodstream. Well, for that glucose to get into cells, insulin is the key that unlocks that and takes that glucose into the cell. So insulin is really important. It's a part of energy metabolism. And why that's so important is if you don't have that key to unlock that, then you just have high levels of glucose in the bloodstream, which eventually leads to diabetes.
Yeah.
So if we're eating a high carbohydrate diet, lots of sugars, fats, that type of thing, then our insulin levels are rising, our glucose levels are rising, and then that leads to insulin resistance, where elevated high levels of that, and metabolically we're just really unhealthy. High levels of inflammation, such as in polycystic ovarian syndrome, which I've kind of touched on earlier. And polycystic ovarian syndrome and insulin go hand in hand. As far as that goes, maybe talking a little bit more about what PCOS is when you have high insulin levels, your body doesn't convert your testosterone to estrogen. So in women, what happens is you have all these follicles in your ovary that are basically immature follicles that can't turn into eggs, and so they can't be. You have problems with ovulation, fertility. So you're kind of stuck in that cycle where your estrogen levels are low, testosterone is high, and so women might see these are some of the signs of PCOS. Yeah. You might have acne, unwanted facial hair. Those things are fine in guys, but not in women, sure, right?
Yeah.
You might notice skin tags, especially on your upper shoulders. Some velvety patches on your neck and shoulders. That's signs of PCOS and insulin resistance. Irregular periods, problems getting pregnant. Those are all because of high insulin levels.
I'm going to ask you a question. Okay. What does it look like in men? Because men, I'm assuming, can also experience high insulin level and insulin resistance.
Yes. So in men, that can look like erectile dysfunction. So problems that way. Also, like we mentioned before, skin tags, that's a big thing. High blood pressure, cardiovascular disease, elevated A1C is a common thing that gets tested. Yeah. Also, something that doesn't get tested a lot, but it's something that I like to have a lot of my patients ask their PCP to have drawn, is your fasting insulin level. And I think the current healthcare system is pretty resistant to having that tested. We're so glucose centric. We're always testing like, what's your fasting glucose level? What's your A1C if you're a diabetic? But we're not focused on that fasting insulin level, which I think is very interesting because that fasting insulin level can actually let you know if you're diabetic up to 10 years earlier than a fasting glucose level can.
Yeah.
It's just we're lagging a little bit in that department, but I do like that some of the functional medicine practitioners are on that. They're like, yeah, we should know what your fasting insulin level is.
It's funny you mentioned that because that was a little bit of my experience. I didn't take my fasting insulin level before getting on GLP-1 medications, but about a year after I was on it, I went to my PCP and I did just that. I was like, hey, would love to see what my fasting insulin levels were. Historically, I've had wonderful A1Cs, like my glucose levels have always been normal, although I've had some of those like other indicators that you mentioned, like high blood pressure and high cholesterol, which runs in my family quite a bit. And I was overweight at the time. And so when I asked him for that, he was like, why do you need that? Like, it was like there was a resistance towards it. And no shade to him, right? Like, I'm sure his medical training, and he actually did say, like, my medical training has me focus on the A1C, the fasting glucose level.
Yes.
I know how to read that, but I don't know how to read the fasting insulin. So, like, I wouldn't know how to read that, the results of your blood test on that. Luckily, between you and other providers at Anew Therapy, and other providers that focus on GLP-1 medications, weight loss help, and that specialization, I was able to get it read, and I had a healthier reading of my insulin resistance and the fasting insulin levels. I wish I had historical data, but other indicators helped me kind of paint the picture of there was probably some insulin resistance, even though my fasting glucose levels were always normal, right?
Yes,
but there's
yes.
Your insulin is working extra hard to bring your glucose level to normal is how I was understanding it when I talked to my provider. And so all of that to say that I love that this indicator, and I wish I'd known that, and I wish more providers knew that there is an indicator that can actually help prevent diabetes and high glucose levels. Because I feel like sometimes our medical system gets to these problems and these diseases a little too late. Having a GLP-1 accessible can really help someone turn their health around. It helped me for sure.
Yeah, absolutely. I love that. In my personal experience, once I finally did get my fasting insulin levels tested, I was at a 25, which is very high for fasting insulin. And then after being on the GLP-1 for about a year, retested, and I was at 6.9. Wow. So that can show you, big difference. As far as fasting insulin levels, I recommend 7 or lower is a good fasting insulin level. So
I was right around this 7, 8. I can't quite remember, but it's improved quite a bit. Yeah,
love it.
You mentioned inflammation that comes from insulin resistance. I know a lot of people actually experience a lot of positive effects on the inflammation side by being on a GLP-1. Can you explain a little bit of what that looks like? And I know that also helps mental health in some way.
Yeah. I love that question. Such a good question. These medications do help with inflammation systemically. And from speaking from personal experience with PCOS, after being on the medication, even for a week or so, I did notice, although a lot of water weight, I think we're just holding on to a lot of water weight, did systemically help with that. I noticed a difference in my wedding ring, just in my overall, in my legs, that type of thing. It does help systemically with inflammation by, keeping those blood sugar levels constant, taking that high insulin levels down, regulating your metabolism overall. And it does help in the brain. That inflammation piece does help in those parts of the brain that, they're calling Alzheimer's disease, type 3 diabetes, which is actually a metabolic disease. Wow. And so things like that, the inflammation systemically, it is affecting your brain also. So GLP-1s do help as far as that goes.
What are some of the mental health conditions that someone should be disclosing or thinking about when talking to a provider about getting on a GLP-1 medication?
If they already have underlying anxiety, specifically I'm talking about semaglutide, that could increase a patient's anxiety level. I feel like tirzepatide does a little bit better on that front, but I definitely need to disclose to your provider, if you're bipolar or anxiety, depression, all those things I think should be discussed. Eating disorders, for example, those are things that need to be disclosed before, you need to talk with your provider and make a decision about that and just see, overall if it's a good fit, because it is not, a one size fits all kind of thing.
Yeah.
It's a case by case. But as far as the mental health world, I have seen great benefits with patients that have anxiety and depression. It just needs to be a very thoughtful, well thought out decision.
Yeah. Yeah. I can imagine that someone with high levels of anxiety, even just the anticipation of taking the drug, right? Like, what side effects am I going to be feeling? Like, what's it going to do to my body? Like, is it going to work? Like, all of those things can be exacerbated if you're not disclosing it and talking about it with your provider. How do you help patients who may have like a little bit of that like high anxiety getting on or anticipation of side effects? Yes. How do you help them navigate?
I feel like I do a good job of educating them about what to expect.
Sure.
As far as most common side effects of these GLP-1 medications are nausea, heartburn, constipation, diarrhea. A lot of those side effects do go away within the first month. The first month is kind of like I like to call it like a loading dose. We're on a low dose. It's very thoughtful. And then we just gently titrate, meaning we gently increase that dose by 2 to 3 units a week as needed. I am very conservative in my dosing compared to other providers that I have seen out in the real world. And so, I have had some patients come to me and they're like, my provider started me on this dose. And I'm like, wow, that's a high dose. We're going to be a lot more thoughtful and just titrate very slowly, whatnot, and get you to a place where, you're feeling good. But the thing is to remember, we still need you to be eating. You still have to be very thoughtful and intentional about your protein intake, your water consumption, your movement, all those things you have to take into consideration for down the road when we have the conversation of, okay, are we switching to maintenance? Are you going off the medication for a couple months? Which I do think is a good thing. I think it's good for patients not to feel like, they're so reliant on the medication and know that if they create those healthy habits now, that they have the tools and the knowledge, if they decide to go off the medication, it's a positive thing.
Yeah. I like that intentionality. And that's why I think it's really important as a patient to have like that trust in your provider and that open conversation with your provider so that they are able to help you navigate the mental health part of going through a physical transformation. You mentioned eating disorders. There's a lot of buzz in the media around how people with eating disorders going to GLP-1s and almost exacerbating some of their unhealthy eating habits, right? Avoiding food, because there is an appetite suppression. There is that component to the medication. How do you navigate someone who might have an eating disorder or tendencies for an eating disorder in consulting them or helping them navigate going or not going on a GLP-1 medication?
Yeah, so that can be tricky. So as far as like anorexia, I would not recommend going on a GLP-1 medication. Bulimia, very rare case by case. Sometimes those things, if you already have a tendency to count calories, restrict food, not eating for long periods of time, that type of thing, these medications might be triggering for you in some aspects. And so we have to be very thoughtful and mindful of those. As far as weighing yourself daily, I discourage my patients from doing that. You should be weighing yourself maybe once a week before you inject your medication just to kind of see how things are going and note any change in weight, but not being so hyperfixating on those details and just being able to live a normal, healthy life and go about your day and just trying to implement those healthy changes, focusing like we talked about, I always tell my patients, prioritize protein, fill with healthy fats. We're not fat phobic. We're still eating, avocados and coconut oil and cooking with coconut and avocado oil and those types of things, eating eggs. We're not counting calories. We're controlling our carbs, but I still want you eating fruits and vegetables and focusing on fiber and, getting 60 to 80 ounces of water a day. So focusing on those things are really important, but not getting fixated on certain aspects of it. It's kind of a freeing thing. I don't want you counting calories. If the only thing that I have patients track is their grams of protein a day.
Yeah.
And so it's kind of freeing that way. A lot of patients will have them put like a sticky note on their fridge and just keep track of their protein grams for the day. As far as recommendations go for protein, it's 1 gram of protein per pound of ideal body weight. So if I 150-pound person, they should realistically be eating 150 grams of protein, which can be kind of overwhelming.
Sure.
And so we talk about ways to, work through that and talk about meal prep and different things to help them overcome those challenges.
But what I love what you're saying and what I'm hearing you say is there's a focus on how you're eating, right? Like, I think it's very easy for someone to hear GLP-1 medication, appetite suppression, food noise is gone, no more food, right? But it's like quite the opposite based on how I'm hearing you describe it. You should be focusing on eating healthy, on fueling your body, eating carbs and protein and fats, and like keeping a well-rounded diet around. I know that for me in my personal experience, it's been extremely helpful to track protein, to stay focused on physical movement, right? Walking, exercise, all of those things have to come in conjunction. And I think that's probably what's like where the intersection for me personally of like mental health and being on GLP-1 came, is that I was very intentional going on a GLP-1 to focus healthily on my eating habits, on my like physical movement habits. And we know that eating well and moving your body also affects your mental health, right? Like every therapist I've ever talked to before going on a GLP-1 would be like, are you going outside and are you going on a walk? Like, are you getting some sunlight? Like those things help someone going through a mental health journey. So it can be a really helpful tool to help with that as well. At least it's been for me.
Yeah, absolutely. Those two go so hand in hand. The mental and physical health is like peanut butter and jelly. They just go together. And when you're feeling better in one aspect, the other aspect is gonna, you're gonna feel better mentally or physically, vice versa. So yeah, they go hand in hand.
I've asked this question to some of our other providers that have specialized in different areas, but is there any like red flags or things that people should look out for? Not everyone can get care from Anew Therapy. Maybe we have some people out of state or don't have easy access to us. Are there any red flags that they should look out for when meeting a provider about getting on a GLP-1?
Yes. Yeah. So I want to clarify. So at Anew Therapy, we do prescribe compounded semaglutide or tirzepatide. So I usually don't prescribe the brand name medications just because with the compound semaglutide or tirzepatide, I love it because I can dose it specific to that patient's needs and I can titrate it very slowly, which I totally love the patient to have. We have this relationship where we're talking about their medication. We'll have the initial consult, which I do free initial consults at Anew Therapy. We'll talk about, their goals, that type of thing, clear them for medication if appropriate. And then we'll have a checkup at 7 weeks, check in and see how they're doing. It gives them just enough time to kind of get through that first month, make sure they're not having any side effects that are, concerning. And then I'll check up with them every 12 weeks. So I'm there to hold their hand along this journey and just make sure things are going well. Other places, you can go online and fill out a 30-minute survey like we had mentioned before, and they can be prescribed the medication. That's a red flag. They're not having a thorough medical examination. Like, we need to talk about your history, surgical history. Do you have any family history of thyroid cancer? Things like that, important things that I need to make sure that you don't have. And then, making sure that it's appropriate, like eating disorders. We don't have a history of eating disorders. What are your goals? Like, why do you want to be on this medication? It's important to figure out what's your why. Like, have you been struggling with weight your whole life? Is this something that's really holding you back? I like knowing patients' why, hearing them tell me, their last history over their last 10 to 20 years, how have things gone, where they are mentally, because that really plays a big part. Are they ready for this? Because there is some body dysmorphia, even patients that, I have some patients that have lost 100, 150 pounds. And you're a new person now. How do you deal with that? You look in the mirror and see someone different. And it is challenging in some aspects. So there's a lot of different things to think about that way. Another thing, a red flag could be some of these med spas that I've seen around the valley that have like pre-filled syringes that patients will pick up weekly, monthly. Do you really know what's in that syringe?
Yeah.
Is it diluted? Is it, where is it coming from as far as the direct source? Here in Utah, I love using a local compound pharmacy that I trust, that I know the pharmacist. And so knowing your source, where is that coming from?
Sure.
That makes a big difference. So those are some of the things as far as red flags go that stick out to me.
Yeah. Semaglutide, tirzepatide, we've used, they're the words that I've heard like Ozempic, Wegovy. What is the relationship between all of these terms and different names for a GLP-1 medication?
Yes. So there are brand name GLP-1s on the market, and there are compound medications on the market, GLP-1s. So basically the difference is with the brand names, it's going to be semaglutide or tirzepatide. With the compounds, it's going to be these same GLP-1 medications, tirzepatide or semaglutide, but they add in B12 or glycine, which is like an amino acid to help with muscle wasting. So as far as that goes, going back to semaglutide, it's a GLP-1 medication. It works on the brain, like we mentioned before, the brain and intestines, slowing down your gastric emptying, helps you feel full, increases satiety, that type of thing. And then they added on tirzepatide, which actually works on 2 different receptors. So semaglutide works on 1 receptor, GLP. Tirzepatide works on 2 receptors in the brain and in the small intestine, the GIP and the GLP. So it's about 20% more effective, does the same types of things, maybe a little bit more insulin sensitivity. For most of my patients, I'd say about 90% of my patients are on tirzepatide. And you probably are thinking, why? Why is that? Well, it's more effective. So a little bit more effective with the weight loss and less side effects. So less nausea, less vomiting. If a patient has an underlying, baseline of anxiety, I would probably put them on tirzepatide. I found with semaglutide, if you have underlying anxiety, that can actually increase your anxiety. So tirzepatide's the best option.
Yeah.
And like I said, 90% of my patients. There is something, I have had a lot of patients asking me, there's been some talk of a new GLP-1 in the market, which is called retatrutide. It's still in phase 3 clinical trials, expected to be approved by the FDA late summer. So that's kind of exciting. So it works on the GLP, GIP, and it works on your glucagon receptors. So it's supposed to target more of that visceral fat. So I've had a lot of patients asking me about that lately, and we'll have to see and wait and see what the FDA does.
That's really cool. Lots of options in the market.
Yes.
If it's super easy to access, I would just ask some more questions, right? Like is what I would maybe say. And what I love about going to Anew is that there is that patient-centric care. There is a person that you're talking to on the other side that you're consulting with, so that you're not making this decision on your own, because it is your body, it is your life. It is, I think, really easy to want to just be like, I just want to do it really fast and really quickly and just get it shipped to my house and just move on with my life. But this is your body, this is your health, your mental health, not just your physical health, as we've been talking, and that you should ask questions and be careful and be conscious of how you're doing it. And to be able to speak to someone who's a professional in this space, I think goes a really long way. And that's guaranteed at Anew. You're not talking to an AI robot, you're talking to a person.
Yes, and I actually encourage my patients to reach out. A lot of patients will text via Podium, via our messaging, and say, hey, I have a question for the provider. And I actually love that when patients reach out and say, hey, is this side effect normal? I do have some patients where they've had some, vomiting, some nausea that was a little bit more than normal. And so we have ways to treat that, increasing electrolytes, eating closer together, not spacing out things as far as, that goes. But just there's like little tips and tricks. So I love the fact that patients can reach out, ask questions. I'm happy to do that.
I love it. Yeah. What would you say to people who place a stigma or judgment on GLP-1 medication?
Yeah, I love that question. Yeah, I would say to those people not to be judgmental, because this isn't a shortcut. This is just a tool that you can have in your tool belt, helping with metabolic disease. In my instance, in my case, I had tried for many years through diet and exercise and things. It wasn't a lack of effort. It was actually a metabolic disease. If you had a patient with cancer, would you say to them, you didn't try hard enough? You didn't fight hard enough?
Yeah.
You didn't have enough willpower? We wouldn't do that. And so there is some stigma regarding that, where, a lot of patients, people on social media have, taken this drug in secrecy and don't want to talk about it, that type of thing. But I think we need to talk about it more. It's an underlying metabolic problem, and it's okay to use it.
Yeah. I mean, I also can speak from personal experience. I haven't shared widely. I think this is the most publicly I've talked about being on a GLP-1 medication, because there is a little bit of a stigma, like, oh, is it a shortcut? And like, I make it a conscious effort, like, on social media, like, you're like, I'm exercising, like, you almost want to prove to people, like, even family and people, friends that are close, like, almost like want to prove. I don't exercise to prove it to people, but like, there is that like behind the mind kind of thing, like, are people going to think I'm on a GLP-1? But to your point, like, let's remove the stigma from it. There isn't a stigma around it. I had a friend explain it to me as like you want your body to work with you, not against you, right? Because I hear over and over again people that have opened up to me about being on a GLP-1. It's like, I've done all the things. I eat healthy. I exercise regularly. That was my experience. I ate healthy. I exercised regularly, and my body wasn't following what it should have followed, right? And so it's, like remove the stigma from it. It helps. And there isn't anything wrong. You wouldn't say that, to your point, person with cancer, don't seek medical treatment for your cancer. Your body should do it by its own. You should not apply that same logic to.
Yeah, absolutely. It just helps things metabolically become synced and things just click and work like they didn't before. Yeah. And I think, just using it as a tool, not saying that you're relying on it 100%, but it is a tool in your toolbox. And it's not taking away the effort. We're still trying and, exercising, nutrition, hydration, those types of things. It is a lifestyle overhaul, but with that extra tool, it is a game changer.
Yeah. And those brand names, you maybe a little harder to access, but I like that very simple explanation of this is what they are.
Yeah. I wanted to mention also, so there are some other things that patients are like, I don't want to go on a GLP-1 medication, but what other options, maybe natural options, can I pursue? There is berberine, which is a supplement. It's kind of hot on the market. Inositol, which maybe a lot of patients haven't heard about. But when I was doing my OBGYN rotations, patients that had any issues with fertility, insulin resistance, that's a really good one. It's a white powder that you'd add to your protein shake in the morning, 8 grams. It'll really help with your insulin sensitivity. So that's a great one. If you have PCOS, fertility issues, you can just buy it over the counter. There's a lot of talk about yerba mate, which is like a drink that helps with insulin sensitivity. So those are all good options. If you're looking for something, you're not ready to start a GLP-1, berberine, inositol, or yerba mate might be a good option.
That's really cool. So many options.
Yes.
We have a segment on the podcast where we ask patients, friends, family of the podcast quick questions, like rapid fires. So can I ask you a few rapid fire questions that we've gotten from some of our listeners?
Of course.
Okay.
Let's do it.
I'm sure we could probably go deep into them, but we're going to keep these rapid fire.
Okay.
So do GLPs change your metabolism or just your appetite?
Both. Yeah, absolutely. Metabolism for sure.
Absolutely. I mean, we've talked quite a bit about
both.
all of the things. Why do I feel tired or foggy, and what should I check first?
While on a GLP-1 medication specifically. So that can be a common thing. A couple days after taking the medication, it takes your body a little bit of time to adjust. So, making sure you're eating enough food, taking your vitamins, supplements, that type of thing. So seeing what other things, sleep, are you getting enough sleep, those type of things. For sure.
What if my mood dips after a dose increase?
No, I love that. I think keeping tabs on that and seeing, if you feel like depression, anxiety is increasing, then that's something definitely to bring up with your provider. Like we talked about with semaglutide, it can increase anxiety levels. So just keeping tabs on that. And if, you're talking with your partner, your loved ones, bringing those things up, making them aware, talking about how you're feeling is so important.
Yeah, absolutely. Yeah. Can I still enjoy food, or will everything feel muted?
I love this question. Absolutely. You can still enjoy food. You're just going to want to eat smaller portions. If you normally would eat like a carton of ice cream, you're going to want to eat like a smaller portion, a small bowl of ice cream. So it's not like eliminating any food groups. Sure. You're just more intentional and thoughtful with what you're eating.
It's so true. Like I kind of, not that I had an actual fear of like not wanting to I love chocolate. I love ice cream. I love chocolate desserts. I literally can have a bite of something and be like, wow, that was enough. And it's like the weirdest, at first it was the weirdest feeling to just be like, I just want to eat the whole cake, right? Or the whole, but yeah, you will still enjoy food.
Yes.
I can attest to that. What should I do if nausea makes me avoid eating altogether?
Ooh, like I talked about, that's why I love the provider check-ins, but talking with your provider, making sure you're eating small meals. I like to have patients add electrolytes to their water. That'll help with nausea. And then just, being upfront with your provider, letting them know there's options like Zofran we can prescribe. So the conversation.
That's great. How do I talk to my partner about body changes without spiraling?
Yeah, I think just having open and honest conversation about how you're feeling in your body, just feeling like you can share those thoughts and those feelings. And then, if you're having additional issues, talking to provider and letting them know like how you're feeling. Yeah.
I would say from my experience, body neutral, right? Like we're not chasing an ideal body shape or ideal body type. It's just acknowledging that your body that will change, is changing, and just having an open and honest conversation, but not putting too much emphasis on seeking a certain body image.
Yes, or a certain number.
Yeah.
It's really, I mean, we do use BMI and charting just to kind of have a guideline, but really it's how you feel in your clothes and how you feel in your own skin. That's what's most important.
Last one. What are the first signs I need more support than medication alone?
Yeah, if you're feeling like mood swings, that type of thing, just feeling like you're not happy, you're anxious, depressed, that type of thing, then I think maybe you need to add on, talking with a therapist. Some of those lifestyle habits. Are you getting enough sleep? Are you taking care of yourself? Are you eating well?
Yeah.
Are you exercising? Do you have proper hydration? So I think it's the whole lifestyle. How are things outside of taking the medication?
Yeah, I know I've had some friends like hit plateaus, right? Like, the medication isn't working anymore. Like those were some of the things that they would say. And it's like, I usually tell them, because I've had such great providers remind me, like, are you drinking enough water? Like, are you having enough electrolytes? Like sometimes it's a simple thing as like, just go on a walk, go on a 10, 15-minute walk. Those things do help a ton while on this medication. So
yeah, the small things really add up.
They do. If someone is considering a GLP and is also struggling with something like depression or anxiety, what are, the top 3 things that you would say before exploring your options?
Yeah. So I would definitely talk to a mental health provider, see if it's appropriate. You can always do a free consultation at Anew Therapy. We'll take really good care of you as far as that goes. But set yourself up for success. Be open to making those lifestyle changes, because if you make those lifestyle changes in addition with using the medication, you're going to see the greatest success. So being open to that. And then if you need help along the journey, being open to talking to your partner, your friends, your spouse, and seeking help if you need additional help along the way.
Well, there are wonderful providers like yourself at Anew that are eager and willing to help anyone who wants to explore these options. Andrea, thank you so much for coming on the podcast and sharing your knowledge with us. As always, if you want to reach out to Anew, you can go to anewtherapyutah.com. You can text the number on the webpage or call, and someone will answer the phone and help you out. But again, thank you.
Yeah, thanks for having me.